Hi, Stonington. Thanks for tuning in today. We wanted to share a special message today in regards to COVID and in particular about mental health. So we're really happy to have Leanne, our Director of Human Services for Town of Stonington, and Miranda, who is a licensed clinical social worker. She's one of our counselors and also actually the supervisor of the program. So we're really honored that they took the time to be with us today. We just wanted to start by saying we know not just in Stonington, but nationwide, mental health issues are at the forefront of this COVID crisis. We've seen an alarming rate of concern around teen suicide and depression rates. A recent study found that 1 in 4 young adults have considered suicide. 7 in 10 teens have said they're struggling with mental health. And of those, 2/3 said they were trying to deal with that on their own, which is obviously concerning. Looking at the broader adult population, another study found 2 in 3 said that due to the uncertainty around COVID, they felt increased stress. And the Mental Health Association found a 93% increase in people seeking services for depression and anxiety just from January to September alone. So because of some of these things that we wanted to be sure people in the community were aware of warning signs of people around them who might be struggling with mental health, and also some tips for how we can help ourselves and help each other, and also to be sure you know about some of the services that we offer here in Stonington. So maybe Miranda, do you mind starting for us?
Sure. Thanks for having me today. This is a good opportunity to reach out and a step for hopefully those out there who are really struggling. Just keep in mind, everybody has been affected this year. It is a historic year in our history, the world, and so there's not anybody that hasn't been affected, whether it be people working on the front lines. We shouldn't ever forget them. I know compassion fatigue can set in at times for them. People who might have lost loved ones this year. Dealing with economic stresses in their home or their business, students, teachers, people in education. I mean, that's a huge situation. Everything's kind of been turned upside down. Well, has been turned upside down. Those who are homebound for different reasons, our seniors, some of them who are used to being involved, being out more, that aren't able to do that right now. People struggling with addiction and being in a potentially harmful or harmful domestic situations. So everything has been affected across the board. As far as warning signs, I mean, obviously everybody's been affected, but those who have a prior history of depression, anxiety, and suicidal thinking are definitely people that could be more at risk. Substance use, people who have a sense of hopelessness as well. So one of the things we hope, through this and through all of everybody's efforts in the community, we hope to do is to let people know that there are resources out there. There are people that care. And as far as, I don't know about tips yet, whether we're to that part yet, but our program here, I'll just mention that we are not an emergency or crisis-oriented program, but we do offer counseling for Stonington residents. It's free of charge, and normally we start, if you'd like an intake, you just call our office 535-5015 and ask about the program or an intake. And, we see what we can help connect you with and the support you might need. It's considered short term, about 3 to 6 months, 12 sessions. Folks come in and we help, them figure out what they want better, different, more of, less of in their lives, and try and come up with a plan. So
That's great. Miranda, can you remind us, is that for all ages, or what age groups do you work with?
Thank you for asking. There was more to it. Generally, these days, it's more of a school age and up. So it's a little, especially now, because most of our work, normally we're in person, but most of our work is by telephone right now. We do have a few exceptions to that where we can meet. I sometimes meet with folks outdoors. We did that a lot over the summer. So there are some limitations. If for some reason we can't serve someone, whether they need a higher level of care or there's other extenuating circumstances, we will help link them up with another provider that can help with that. So yeah, pretty much. If you're looking for support, yeah, give us a ring. As far as more of a higher level support and emergency support, I know Leanne has a sign with a phone number. If you're feeling suicidal, if you know somebody who is feeling suicidal, there is help. And it's the suicide suicide prevention Lifeline. Really easy to access by phone or on the web. It's 1-800-273-TALK, TALK, or 8255 are the numbers. There's also a crisis text line. So if you're a texter, 741-741, you text. There's 211ct.org or 211. And obviously, if there's a life-threatening crisis situation, you should be calling 911, and they'll help you. And I mean, there's lots of other supports out there as well, but those are some of them that you can access.
Thank you, Miranda, so much. And we'll provide a link with all those numbers. So thank you. And then Liam, maybe over to you to talk a little bit about some of the work at Human Services and in the community.
Sure. So thanks again for having us come on. Anytime we have an opportunity to kind of reach more people that aren't familiar with our services is a great one, especially around the holidays. As you mentioned, people are already feeling stressed, and then being home alone on the holidays, and we've got a big winter storm coming our way and the weather's getting colder. This is the best reminder to check on your vulnerable neighbors, family, friends. Give them a call, knock on their door, see how they're doing. We've worked closely with the SHARE program. Stonington helps area residents in emergencies, and that was a grassroots program started by just local volunteers in the community. And they're working really hard to still do that grocery shopping and running errands free of charge. You will have to pay for your own groceries and whatever they're picking up for you, but the service itself, unlike Instacart or other services like that, is free of charge. And it's a bit more personal because it's connecting you with actual Stonington residents. Through this program, they'll also do phone call check-ins, which we're doing that as well with the You Are Not Alone program here at Human Services, and that's just kind of a weekly check-in for seniors or homebound individuals who have signed up to get some extra care and support. So as Miranda mentioned, we do have these mental health matters signs that we just had made up, and they're actually lawn signs that we have available here at Human Services. And if you're interested in putting one in front of your home or business, we have plenty here to share with you. And it's just basically trying to break that stigma of mental health and getting help for when you're feeling like struggling. And it's okay to ask for help and to not struggle alone. Struggling not only from COVID, but all the things that lead into dealing with a pandemic, with winter coming down. We've got the eviction moratorium. It's up in the air right now. People are still dealing with extended unemployment, with benefits starting to run out. So at Human Services, we try to, look outside of the box and try to meet whatever need we can. If we can't do it here within our facility, we network with our local nonprofits, whether it's rental assistance, energy assistance, having trouble paying car insurance, getting on medical insurance, getting on the SNAP program, formerly known as food stamps. I encourage anybody in any type of need that's a Stonington resident to give us a call. If you look on our Facebook or our website and you're not quite sure if we do something, call us. And one of our case managers will be more than happy to work with you to network you with the right resource if we can't provide it here.
Thank you guys so much. I think this was a great overview. Any last closing remarks for the community?
I have a couple of just tips along with what Leanne said, just for the general everyday person going through all this stuff that has been happening, really important to really focus on your mindset, healthy routines, self-care habits. If there are things you're doing or not doing that are not helping you find some balance, then maybe some little adjustments can be made to help with that. To simplify along those lines, everybody takes on a lot, and it's okay, like Leanne said, to, set some boundaries and say no and take a minute and all that good stuff. That goes for everybody here. Along those lines, technology, I know those of you who are watching this right now are looking at technology, and it can be great, but it can also be an overload, as we know. So make sure you unplug enough in this. Make sure, try to educate yourself, get reliable information. That's really helpful. There's so many great resources out there and people willing to help if you need it. So like Leanne also said, no one is alone in this. My personal favorite, get moving, get outside if you can, as you're able. I know some people aren't able to do that, but whenever you can even get in front of a sunny window when the sun's out, that helps with your wellness and well-being. Along those lines, if you've got some extra time, when you're unplugged or trying to sleep, just start daydreaming and visualize what you really want, what you want to have happen. In actually doing that, your brain kind of tricks itself to kind of believing that, which is good, and helps you open your mind to possibilities. So never give up on that. Daily, I'm going on a little bit here, but daily expressions of gratitude, kindness. There's research that absolutely supports if you take time to be thankful and grateful and think about the things you have versus what you don't. That can really actually start changing the way your mindset works. Doing good for others, expressing yourself, getting creative, spiritual practices, meditation, prayer, all good. And just being curious about something maybe you haven't been, you want to learn about, or even curious about what's going on in your own situation can help you learn from this whole period of time in our lives. And really important, just look for examples of resilience, because they're everywhere and everybody's in a different boat, but we can learn from each other and how we move forward. So I hope those are some helpful things for everybody really to keep in mind.
Thank you so much, Miranda. That was really helpful. I know at least 3 things I'm going to try tonight from your list.
I do them anyway, but we forget. We really do. We forget what the basics, the simple, and got to start somewhere, right?
Yeah. No, thank you. And Leanne, any last closing comments from you?
Sure. So Miranda mentioned really, really great resources and outlets. And one thing that we had talked about just prior to talking to you this morning is our Hike Stonington program is still thriving. So a lot of our rec programs have had to been put on the back burner or go virtual and scale back. Hike Stonington is flourishing right now. We've had hundreds of residents sign up for the program, and basically we'll connect you with all of our local hiking trails. It's a free program. If you complete all the hikes, you get a nice t-shirt at the end. And we actually just had an awesome footbridge installed down in Spelman Park just this week. So, get outside as much as possible. And again, give us a call at 860-535-5015. Look us up on Facebook or on our webpage, and we're happy to help however we can.
Thank you so much. Thank you, Leanne. Thank you, Miranda. And thank you, Stonington.
Merry days. Happy season. Go team.